And this sodium potassium pump has a very nice function in the pumping of blood even to the brain. So once these electrolytes are not at their good normal range, if I can say, so it means your blood saturation is being disturbed as well. And the one which will be touched by this matter at the first will be your brain. So it means your brain will be in an unstable condition, if I can say. So the onset of hypovolemic stroke of blood and the development of higher grade gastrointestinal hemorrhage, all these are the things because you have been experiencing the area for a longer time. So as long as the longer you experience this diarrhea, hemorrhage is going to start again. You understand? So these are a horrible thing that has started with the Escherichia coli. Remember, that has a journey that has started with the Escherichia coli from the screen of your phone. So now the things are becoming severe, but you have not heard about this. I'm going to talk about the severe abdominal cramping. Then it is going to start due to the hemorrhage and all those things that you have experienced above, and the smooth muscles spasm are going to start, and intractable nausea preventing oral intake of anything is going to start as well, and the projectile emesis leading to marrowy wastes, mucosal tears, and the alteration of the hemostatic gut skin axis and the prolonged post-infectious irritable syndrome is going to go on as well. So this is not enough. As long as all these things are happening, there will be a systemic glycemic dysregulation from acute metabolic stress. There will be elevation of blood urea nitrogen, BUN, levels. And the dangerous of it, there you will see the accumulation of serum creatinine. You understand? And then the acute lactic acidosis due to the tissue hypoperfusion and the systemic metabolic exhaustion. So you need to pay attention so much about your phone. These were the gastrointestinal things that we will see when you don't pay attention. You understand? So, and the pathogenesis as well. So now we are going to talk about hematological and the systemic inflammation. So the direct microvascular invasion into systemic circulation of some bacteria. You remember a bacteria can be on our skin or somewhere else as a normal flora without causing or harming us or causing anything. But as long as there comes a condition, as long as a condition changes, this bacteria, for example, invade the microvascular, then this will cause and go into a systemic circulation. This will cause a persistent unmitigated bacteremia. You understand? A persistent unmitigated bacteremia. And after this, activation of systemic inflammatory response syndrome will be experienced, and there will be a rapid hepatic synthesis and the spike of serum C-reactive protein and the profound left shift leukocytes, as it has been shown by Ramakrishna in 2013. So endothelial cell activation causing widespread vascular leakage and the severe intravascular coagulation pathway, triggering a profound systemic hypotension and the microvascular thrombosis, leading to peripheral ischemia and the multi-organ hypoperfusion. All those things are the things that are showing how severe a condition is becoming. You understand? We are talking about hematological things in the systemic inflammation. So from endothelial cell there, now there will be a higher grade favors modifying metabolic baselines, and this will lead to a debilitating generalized myalgia, and this will cause a constant physical malaise, and which will continue to uncompensable resting tachycardia, which can exceed even 100 beat per minute, and acute tachypnea due to systemic oxygen demand. So all those things that will be happening, don't forget the source, the origin. It is on our screen, and as this will not be enough, there will be a painful regional lymphadenopathy, painful in regional lymphadenopathy, and elevated serum lactate, indicating anaerobic switch, a profound systemic metabolic acidosis, and acute phase hypoxemia, in the sudden depression of adrenal metabolic reserves. So all those things that will be happening, remember, they are being caused by the bacteria, by the microbes that have been picked from the screen of our phone. So I'm not trying to help you or to make you hate your phone, if I can understand, because maybe I cannot reach at that hate. But what I can do how much harmful it will become to you, and how much severe conditions will stress you without knowing the origin. Now I am letting you know the origin. You understand? So we've been talking to dermatological issues. We've been talking to gastrointestinal tract issues with this bacteria, and we talked as well to hematological stuffs and the systemic inflammation. And now we are going to talk about the organ system and the flora. So now it's as if the system has gone a serious problem. Now it is going to the entire organ. So what is going on? The conclusion will be the failure, but from where? As long as we have seen all those things happening above, here we will experience something like acute kidney injury, and secondary we will see the acute kidney injury secondary to severe hypoperfusion, and this will be due to acute tubular necrosis. Acute tubular necrosis. So we are seeing acute kidney secondary to hypoperfusion, and then we are seeing acute tubular necrosis. We are seeing as well toxic shock syndrome, toxin 1. That will drive us as well to multi-organ collapse and toxic myocarditis, reducing ejection fraction, and the development of acute respiratory distress syndrome. So all those things have not gone to the to that very bad, where they can reach, if I can say. But later you will experience intravascular coagulation, disseminated intravascular coagulation, which will lead to spontaneous internal bleeding, and which will lead to septic microemboli seeding into pulmonary architecture, and acute hepatic dysfunction with clinical jaundice and splenomegaly from the heavy immune filtration, and acute metabolic encephalopathy with delirium. So all those things are happening. You have understand the things that the first organs that will be touched by this matter at first is the kidney, then the heart, the lungs, then the heart. You see, so in the river as well. Yes, the river. So these things you need to take them serious, my dear, because they are very dangerous. So we cannot talk about all those systemic things that we've been talking about, and the jump the things that are related to epidemiology and the health hazards that we can meet there. Of course, a rapid proliferation of methicillin resistant like Staphylococcus aureus on shared devices have been shown as so far, and is increasing currently in the antimicrobial resistance issue that is raising day after day, and cross-contamination of sterile laboratory fields via aneuploidy forms, horizontal gene transfer of antibiotic resistance plasmids on grass surfaces, and the neutralization of standard hand hygiene measures have been noticed, not by me, but by Tusabe in 2022. Yes, he noticed this thing, that the antimicrobial resistance that we are even experiencing before it even go outside in the lab because of these phones. And the West Guji zone study of public health has gone so far, if I can say, in research, and says that there is accelerated transmission of multi-drug resistant organisms within intensive care units, and in hospitals, and vector-borne seeding of surgical wounds via practitioner phones. So inflation of regional facility mobility metrics and extended the hospital stay duration. So all those things, remember, if someone was supposed to take like 3 days of stay in hospitalization in a given hospital, and now he's taking there like 3 months or above, because of a practitioner, a nurse, a doctor, or a lab technician who have taken his phone in a given in his or her room. This is very dangerous. It is a thing that needs a point of care, if I can, a point of a serious follow. What can I say? I don't have anything to say because I am not a policymaker or anyone. I'm now no one, but my role is to let you know, my people, how much serious this matter is when it is becoming severe and severe day after day. You understand? So, inflation of regional facility mobility metrics have been noticed, and extended hospital stay durations also have been noticed, and a multi-billion-dollar escalation in annual healthcare expenditures have been also noticed. So we need to pay attention on this matter. So it is not only that, but also a false positive contamination of diagnostic blood cultures via phone to hand transit, tracking of resistant vectors from clinical wards directly into public transport spaces, and exhaustion of frontline beta-lactam antibiotic efficacy, and the structural failure of institutional infection control protocols, and the cross-contamination of pediatric wards, leading to infant diarrhea spikes. All those things have been noticed. So my dear brothers and sisters, you need to understand these things as well. You need to know it and be aware of what is around you. So we cannot go so far, but I cannot go also without talking about secondary and chronic scaria that all this matter will cause. You know, there is a development of post-streptococcal glomerulonephritis, post-streptococcal glomerulonephritis from cutaneous breaches, and which is structurally being damaged, and which is leading to heart valves. You see, structural damage to heart valves, and infectious endocarditis is being experienced today. So via hematogenous seeding and metastatic osteomyelitis within the long bones, it has been also shown that a rapid onset of necrotizing vasculitis, subcutaneous gas gangrene has been also remarked. Has been also noticed by Ramakrishna, that Indian researcher. So you will need to take to pay attention, because he continued saying that the chronic or unhealing ulceration along friction fields and a profound post-inflammatory cutaneous hyperpigmentation and the permanent localized hair follicle obliteration also can be noticed as the things that are being experienced from here. Here you can ask yourself why badness. I mean, those especially from men is increasing. Its prevalence is increasing nowadays. The badness, you know it. I don't know, but so the extensive keloid formation across mobile contact zones, persistent systemic low-grade inflammatory signaling, all those things are the things that are happening. So I have tried so far to go in the searches, in the papers, of course, so that I can show you the extent on this matter is on in our community, if I can say, and if you don't pay attention. And it as a research, I cannot go without touching on something psychological and functional collapse, of course. So like a severe anxiety tied to visible and disfiguring of facial regions, and the clinical depression from recurring systemic illness, and prolonged physical absenteeism from the athletic training or employment. All those things have been noticed, of course, as the psychological parameters, of course, and the chronic elevation of baseline cortisol and the permanent functional disability due to severe tissue scarring. So all those things have been shown by Borrego Luis and in 2024 as the things that are sometimes disturbing, of course, that are disturbing, and that can be which is the reason why it can be taken serious. Let me ask you, for example, if one was supposed to have like 3 days in a given hospitalization in any hospital, but consequently he is going to, or he or she is going to take there like 3 months, isn't this something that is going to touch him or her psychologically? So it means psychological matters, psychological parameters are not even this one's only. There are many and many that are touching patients as well. So we need to take them serious. So as we've been talking about these things, there is like something like an advice, a point of view advice that I can give. We need to take an interventional protocol so that it becomes so that it is not too late, if I can say. So what must be done? We need to disrupt this vector completely, and a rigid evidence-based contamination protocol must be integrated into daily life, and a hand hygiene is statistically irrelevant if a contaminated portable phone is handled immediately afterward. So you need to decontaminate your phone. It's a must. It's not a request. It's a must. You need to decontaminate your phone on arrival and on exit, if I can say. You understand? On arrival and on exit. On arrival, it will prevent those who are inside. On exit, it will prevent those whom you are. No, it will protect you. It will protect you. On arrival, it will protect those whom you are who are inside, and on exit, it will protect you from anything that you can take from inside to outside, if I can say. So it is a breaching chain, if I can say. So there must be a disconnected and powered down of all those things, to turn off the mobile device and remove any protective casing. This will eliminate electrical risk and ensures the entire surface area of both the phone and the case interior that can be fully accessed. And also, as the second thing, we need to execute mechanical pre-cleaning. We need to use a dry, rent-free microfiber cloth to wipe down the screen and the chassis. So this will remove the oily lipid layers and the dead skin cells and the sweet residues that form protective biofilm over the underlying bacteria. So this is a next step. The third step we need to apply approved disinfectant solution by rightly dampening our fresh microfiber cloth in a 70% isopropyl alcohol solution, or any electronics safe disinfectant wiper, and then never spray liquid chemical directly onto the device to avoid mixture entry into the charging ports or speakers. And we need, as a next step, the fourth one, to observe chemical contact time by thoroughly wiping all surfaces of the phone and case, ensuring the surfaces remains visibly wet for at least 60%. This duration is vital to compromise bacterial cell walls and ensure full eradication of resistant strains. So this is very much important, and we need also, as the last step of our measure, to implement behavioral isolation. Behavioral isolation, as an ongoing maintenance, we need to establish a strict quarantine rule. Never introduce a portable device into a restroom environments. It tries the hands-free options, wireless earphones or speakerphone, but during athletic or clinical activities,